This is KGW News at 5.
Despite clear statements just a couple of days earlier, he said there were actually no extra vaccines sitting on their shelves. Let me be very clear. This is deception on a national scale.
Oregon Governor Kate Brown furious tonight, saying the federal government lied about sending a surge in COVID vaccines. Thank you for joining us on this Friday evening. I'm Laurel Porter. Oregon thought it would get an extra 200,000 doses on top of what it already expected. KGW's Pat Doris has followed this for us. And Pat, this means older Oregonians are back behind teachers again in the line to get the vaccine?
Right, Laurel. It's going to be agonizing for a lot of folks, and I'm sure it was a tough decision for the governor, but she has made it. The governor had told the two powerful groups they could go at the same time, and they could start a week from tomorrow on the 25th. Now it's just going to be teachers, and it will be on January 25th. Older Oregonians going to have to wait at least 2 weeks after that. Governor Brown lashed out at the Trump administration today, saying they had promised the states they'd send out all those doses kept in reserve. And as you mentioned, that made Oregon leaders think we'd get an extra 200,000 doses, which would be plenty to cover all the teachers and staff and bus drivers in the state. Then last night, the governor learned there is no reserve. It was all sent out 2 weeks ago.
I am shocked and appalled that the federal government would set an expectation with the American people on which they knew they could not deliver with such grave consequences.
The new vaccination schedule has teachers and other school workers eligible to get the vaccine again starting January 25th. Then February 8th, anyone 80 and older could get the shot. The next week, it would include anyone 75 and older, and then would keep dropping down to 65 and older on March 1st. Despite the alarming news, there is some encouraging news. The four big hospital systems in the greater Portland area are collaborating now on a mass vaccination program, which they'll launch next week at the Oregon Convention Center. They say they, in the beginning, can do about 5,000 people a day, but if they have enough supplies, they believe they could ramp that up to about 25,000 a day. If they're able to do that, they could cover half of the teachers, bus drivers, and staff in the state in just 2 days. One other stat for you, 173,000 people now have received their first or second shot in Oregon. That's about 53% of all the vaccines sent to the state so far. Back to you.
We're making slow progress. Thank you, Pat. And as Pat explained, people 65 years old and up are once again being prioritized after teachers. Many seniors told KGW they feel left behind.
I was very disappointed, of course. I want all us old senior people to be able to get vaccinated. And it's infuriating. I can't imagine what happened. I mean, they thought there were vaccines and suddenly there aren't. It doesn't make any sense.
It's not that I don't appreciate what teachers do and that I feel they're very valuable. But as someone said the other day, they won't die from this. And I really feel like I will, because my asthma is very bad from childhood. So it's disturbing, and I feel like we get put back because maybe we're not as important.
Governor Brown said one reason she prioritized teachers first is because of the mental health of students. She said kids must get back in schools and teachers must be vaccinated before they return. We also heard from Pat how the major health systems in Oregon want to host mass vaccination clinics. Galen Etlin looks at the logistics of that.
We wanted to know if the new lack of federal doses would impact mass vaccination events. Kaiser's already planning one next week at the Oregon Convention Center in Portland. The idea is to pool vaccine doses from other systems. We spoke with Kaiser, Legacy, OHSU, and Providence. All responded saying they're working on the details. Kaiser said its clinic would launch on Wednesday, the 20th, by appointment only. Legacy's CEO spoke at Governor Brown's news conference Friday, saying plans are still on to eventually ramp up to 25,000 vaccinations a day.
Based on what we now know, we're going to start with a model that administers 5,000 vaccines a day, with a plan to scale to 10, 15, 20, or even 25,000 to the degree that the federal government and the state of Oregon can deliver vaccines.
We also reached out to Salem Health, which is helping with the state fairground vaccination site alongside Marion County and the National Guard. Salem Health said it has vaccinated more than 2,000 people a day the last few days with help from 64 airmen.
That effort has allowed them to pretty much double their capacity and throughput there.
In the meantime, an Oregon group representing 33 county and community healthcare centers says smaller community health clinics could help.
Health centers are trusted healthcare providers, and they have a mission of health equity and decreasing health disparities in communities. They've also been working at the populations that are most at risk during the pandemic.
That means some minority groups and people of color who have been disproportionately impacted by COVID-19 with more cases and deaths per capita. Many of those communities also have less trust in government and health systems, so a clinic run by people in their neighborhoods can more easily gain trust.
They're really able to outreach to those communities that have historically had the most hesitancy towards vaccination.
Pharmacies are also pushing for a more active role to vaccinate people in the first priority groups. All of this, of course, depends on vaccine supply and timing. I'm Galen Etlin for KGW News.
26 counties in Oregon are under the strictest coronavirus restrictions. New risk levels started today, and they'll go for 2 weeks. Risk levels determine which businesses can open or which must close. Meanwhile, Baker, Clatsop, Coos, and Morrow went from high risk to extreme risk. That means no indoor dining, gyms and theaters have to close, and retail stores are limited to 50% capacity. Curry County is the only county at a moderate risk for COVID. Turning to Washington, all regions across the state will remain in phase 1 of Governor Jay Inslee's reopening plan until at least January 25th. Regions must meet 4 metrics to move into phase 2. That includes a 2-week decline in case rates and hospital admissions, ICU occupancy that's less than 90%, and a test positivity rate of less than 10%. Oregon is one of 2 states that does not allow indoor workouts in all counties. 26 counties in the extreme risk category cannot hold indoor workouts. Gym owners have continually said that's hurting their clients even more than it's hurting their business. The state says closing indoor gyms is meant to curb the spread of the virus and reduce the number of people we interact with.
And the thing that's frustrating to us is you can go into any other store, and I won't name stores in particular, but they're not watching the social distancing. People are within, a couple feet of each other.
Since the pandemic started 10 months ago, most gyms have been closed to indoor workouts for 5 of those 10 months. If you're headed to the Gorge, you'll want to give yourself some extra travel time. Right now, I-84 is closed in both directions about 3 miles east of Corbett near Rooster Rock. Crews are cleaning up after a crash involving at least 3 trucks. What a mess. ODOT doesn't know when the lanes will reopen, and it's a good idea to trip check before you head out.